Hello and welcome everyone to today's webinar, Behavior Management for Children with Traumatic Stress. My name is Chad Sievers and I'm the Project Manager for Arkansas Building Effective Services for Trauma. And our presenter today is Dr. Glenn Messman, and I'm going to introduce you to him here in just a bit. But first, I want to do a couple of housekeeping items. So during the presentation, we encourage you to use the question feature if you have a question, and that's found on the right side of your screen. So you can type those in and we'll answer those at the end of the webinar. If you're interested in earning a continuing education unit, just be sure to stick around to the very end. A code will be given, and you can email that to me and I'll give some more instructions at the end of the webinar. We are recording the webinar and we'll upload this presentation to our website shortly. We also have a YouTube channel, which is off our website as well. And we're on Facebook, and we frequently post about events, webinars like this, upcoming training. So if child trauma is a topic that you're interested in, be sure to check us out and like us on Facebook or follow us. Okay, Dr. Messman is a licensed clinical psychologist and an associate professor at the University of Arkansas for Medical Sciences and Department of Psychiatry. He specializes in empirically supported psychotherapies for children and adolescents and is a level 1 with an agency trainer for parent-child interaction therapy, or PCIT. Additionally, he conducts evidence-based psychological evaluations for children and adolescents with a wide range of presenting concerns. Dr. Messman is the assistant training director of the UAMS predoctoral clinical psychology internship, and he also participates with ARBEST. So I'm very happy to have him today. I know this topic is a question I get frequently from therapists and foster parents across the state. So I'm going to turn the microphone over to him and we'll get started with the webinar.
Good afternoon, everyone. I'm really happy to be able to talk with you guys today. I know this is a really important issue because I think many people, and myself included sometimes, especially when I was at the beginning of my training, will sometimes forget a little bit about how kids who've experienced trauma, it's not always just those classic symptoms of re-experiencing and avoidance. Many times there are those alterations in kind of behavioral functioning. There's a change in many times of their mood, their irritability. They can be more angry or aggressive. They can be more non-compliant. So many of the times when kids are experiencing traumatic stress, often they're also experiencing different changes in their behavioral functioning too. So it's important to be thinking about how to treat these behavioral difficulties in the context of treating kids who've experienced trauma. And I know one of our most commonly used evidence-based practice for kids who have experienced trauma is trauma-focused cognitive behavioral therapy. And I know a lot of the people on the call probably have done that training through ARBEST as well. But if you remember, one of the core components of TFCBT is parenting. So with those core components, the P of the PRAC skills is parenting and psychoeducation. So a lot of the different behavior management strategies that I'm going to be talking about today really can be incorporated into kind of that P, that parenting component of TFCBT. And if you guys remember, parenting is something that happens all throughout TFCBT. So these are some really important techniques that can be done with children who have experienced trauma. But of course, you have to have your trauma-informed lens and be looking through children who have being thoughtful about how it's done since they have experienced trauma as well. So before I get into some specific techniques of behavior management for kids who've experienced trauma, I want to kind of give an overview about what exactly behavior management is. Well, successful management of children, though, with different challenging behaviors, the oppositionality, the defiance, the anger, and the aggression, it requires a consistent use of a variety of methods, and it needs to be implemented in a coordinated manner. And I highlighted a few different words as part of the definition of behavior management. It really needs to be consistent. So when I work with parents, I often tell them that consistency is the most difficult aspect of what we're going to be doing with parent management training or using behavioral methods, but it is definitely the most important. So if they're able to master the consistency of these behavioral interventions, they're going to probably see a lot of improvement in their child's behaviors. So consistency is extremely important. And also it's a variety of methods. Often parents And caregivers, when they're thinking about behavior management, are often thinking about punishment. They're thinking about timeout or removing privileges, but really behavior management, it's a variety of methods. It's not just punishment strategies to decrease negative behaviors. It's also about increasing positive behaviors through reinforcement systems and rewards and praise, and also developing a closer relationship between parents and children as well. So there's a variety of methods, and it needs to be implemented in a coordinated manner. It's not haphazard. Many of these skills are taught in a developmental approach because each of the skills kind of build on each other, and they're done in a sequential order. And so the remaining kind of bullets on this slide are really about kind of these are the core components of behavior management. And I'm going to go through all these components in a much more detail. So most of the behavior management strategy programs involve developing a more positive or closer relationship between caregivers and their children. It frequently involves helping caregivers give more effective commands to the children so that children will be more compliant. There's usually some strategies to increase behaviors that are pro-social and positive through reinforcement methods, and also decreasing some undesired behaviors through punishment methods. And then also using selective attention, which I'll talk a little bit more in detail later, which is really often an underutilized and technique to be used, because sometimes it is a little difficult to use, but selective attention can be really beneficial as well for kids who are having some behavioral difficulties. So first I'm going to talk about kind of the parent-child interaction skills. So the goal with parent-child interaction skills is to really help increase the child's positive behaviors. And this is typically done through the parent only using some positive behaviors themselves and paying attention to when the child is doing well and giving lots of praise for their behavior. So you're trying to increase the child's positive behavior through different positive behaviors that the parent is or caregiver is doing as well. It's really trying to improve the child's mood and self-esteem and really building that relationship together. So I often talk to parents and ask them if they've had a job outside the home, like what was it like to maybe work for a supervisor that maybe they didn't really feel that close or connected to? Maybe a supervisor that was more unpredictable or just kind of noticed when they did negative things and rarely gave positive feedback. And I often ask the parents, like, what is it like to work for that type of supervisor? And many of them will talk about it's not a positive interaction. They don't feel really motivated for working for them. And that's exactly right, because this is similar to the relationship between parents and children. So children, if they view their parent as someone that's more unpredictable, like I said, doesn't really pay attention to when they do good things and only tell them when they do bad things, children are not going to be as motivated to work as well for their parents. So children, if they have a closer relationship with their parent, are more motivated to behave better. So a lot of the parent-child interaction skills is building that relationship between parents and caregivers and their children. And also it's helping parents kind of improve their monitoring of the child's behavior and respond in a way that's really effective and rewarding. And often these parent-child interaction skills are often taught through a play-based situation between caregivers and their children. Often this is done through kind of 5 minutes of one-on-one kind of playing together in a high-quality interaction. And I'll talk a little bit more later about some specific skills that should be done in more of these parent-child interaction kind of sessions, because this is really by teaching parents how to use high-quality skills to really develop that relationship together and when they're kind of playing and spending time together. And like I said, I'll talk about some more of those skills a little bit. But first, I want to talk about what are some kind of ineffective parent-child interactions. And I'm sure many of you guys that are clinicians and working with families probably witnessed some of this sometimes in your office, and parents and other caregivers interacting with their children maybe having some difficulty. Often some of these ineffective parent-child interactions involve parents giving lots of unnecessary commands to children. They're telling them what to do a lot, especially if they're trying to play together and interact, but parents are kind of leading the play or taking control over the play, and it's just not fun or enjoyable for the child then. Many times when kids and parents are trying to build a relationship, they're playing together, but parents are asking them a lot of questions. And this is kind of, kids are in school a lot during the day or at daycare, and parents are asking lots of questions. And now they're trying to play with their parent or caregiver, and they're asking lots of questions. It's just not as fun or enjoyable. So many times parents really rely solely on asking questions as a way to interact with children, especially young children, when really there's a variety of other methods that can be used that really will better enhance their relationship. Sometimes parents respond to negative attention-seeking behaviors when really the best way to solve that issue is ignoring it because the children are trying to do it for attention. So by actually intervening directly, they're actually reinforcing the child's behavior and making it more difficult. And I'll talk about why that's important later on with selective attention. And also sometimes parents just really fail to notice and positively respond to good behavior that the child is doing, or they're doing it at a very low rate. They're much more likely to respond when the child does something negative as opposed to when they do something positive. So really, when children and parents are kind of playing together and interacting, anything the parent does that really kind of removes the control away from the child and leads to more negative interactions when playing together really are kind of more of this negative parent-child interaction. And I really like my next slide about Dennis the Menace because I think many people kind of view him as having some behavioral difficulties or problems. And you can see in the slide, poor Dennis the Menace, he's in his chair looking at the corner, and he says to himself, or maybe to the cat that's sitting right there. The cat seems a little skeptical of what Dennis the Menace is saying, but he says, "My problem is that I'm always good when no one is watching." And I think that happens a lot with children, that they are behaving, they are doing well, but there is some difficulties with them. Sometimes parents are not always paying attention to it and not always seeing it. So that is something that parents need to be really thoughtful about, that children are doing good behaviors and they need to positively respond to when it happens. So I'm going to talk a little bit more about kind of what positive or effective child interaction skills look like between parents and children. So one of the best things to do in this kind of playtime that they have together that they're maybe doing on a daily basis, you want to use a variety of different skills that lead to more positive interactions. So the first skill that we often teach is called praising. You want parents to do a better job with praising their children. So praise tells exactly, it's really kind of a compliment or anything nice that they're telling the child, and they're telling the child what they did that the parent likes. So good, if they're playing with blocks, like good job building the tower, or you drew a really pretty tree, or that was a really nice drawing, good work staying in the lines if they're coloring. So really it's any type of kind of compliment or praise that they're giving to the child to make them kind of, it makes them feel good, it shows approval, kind of increases the child's self-esteem, and it makes the parent feel good as well for making the kid feel good. And whenever you're giving a praise, the idea is that it's going to make it more likely that the child will do that behavior again in the future. So anything from praising, kind of like from sharing as well, is another good thing to praise, or whenever a child is doing other type of pro-social behaviors like giving compliments or using good manners. So you want teach parents how to praise their child when they're spending time together. Also, you want parents to reflect their child when the child is saying something appropriate. So reflections just repeat or paraphrase what the child actually says, but remember it needs to be something appropriate. So if the child says, "Well, I drew a tree," a parent could just say, "Yes, you made a tree." So the parent is just simply repeating it right back to the child. The child may say, "Oh, the dog has the black nose," and the parent says, "Yes, the dog's nose is black." So once again, they're paraphrasing or repeating it back to the child. And the reason that this is good because it lets the child kind of lead the conversation. It shows that the parent is interested in what the child's doing. It demonstrates acceptance and understanding of the child. It also, for kids that maybe have some subtle language delays, or maybe their verbal skills are a little bit lower, it can help improve speech, and it can help improve verbal communication as well between parents and children. And I'm sorry, I should have said at the beginning, I have a little bit of a cold, so I have a little bit of a cough, and I'm drinking water a little bit. So I apologize if I cough every once in a while. I need to take a sip of water. So we want parents to praise their children, reflect, also imitate what their child is doing too. Once again, you want parents to imitate their child's appropriate behavior. So if the child puts a nose in Mr. Potato Head, guess what? The parent also puts a nose in Mr. Potato Head. Or if the child is coloring a sheet, the parent is coloring a sheet. Imitation is really helpful because it lets the child lead. It shows approval of what the child is doing. It makes kind of a fun activity for the child. It also allows you to make sure that you're playing on the child's actual skill level and you're not playing too young or too old. And also it can lead to kind of turn taking because maybe the child puts a block on a tower and then you put a block, and then the child puts a block. So now you're taking turns. Describing is also important for parents to be doing with their children as well when playing together. So descriptions simply simply say what the child is doing. I always kind of think of the analogy of like a sports announcer. They're just simply a sports announcer is talking exactly what's happening in the sporting event, and the same thing with a parent is just simply describing what's happening in the moment, what the child is doing. So examples could be you're making a tower, you drew a square, you're putting the hat on Mr. Potato Head, you put the girl inside the fire truck. All those things are descriptions of what the child is doing in the moment. Descriptions are good because they let the child lead the play. It shows they're interested. It helps teach the child different concepts. It can model some good speech and vocabulary. It helps the child stay focused and keep their attention for a longer period of time. It helps organize the child's thoughts about the activity as well. And finally, one that I didn't quite put on there is another really positive thing is demonstrating lots of enjoyment. So you want to make sure that the parent is enjoying their time with the child by smiling, laughing, hugging, the child sitting on the parent's lap, the parent maybe giving a pat on the back, and just giving lots of praise. So it lets the child know that the parent really enjoys spending time with them. So we want a lot more of those, and those lead to more positive parent-child interactions. And there's a few things that you want to try to avoid a little bit more when you're kind of trying to build that relationship with a child and you're doing your one-on-one playtime. You want to reduce the questions that are happening as well during the playtime, because questions really require the child to give an answer, and it kind of takes the lead away from the child. Different types of questions are more informational, the how, what, when, who, when, where. Sometimes questions are just hidden commands like, can you please help me pick up the blocks? So we want to kind of avoid questions because it takes the lead away from the child, and it sometimes may seem like you're not really listening to them or you disagree with the child. And once again, this is when you're just trying to build relationship and you're doing that 5 minutes of special kind of playtime every day and that one-on-one high-quality interaction. There are times throughout the day you need to ask questions. That's fine. It's just during that kind of relationship enhancement or building time you want to avoid questions. The same thing with commands as well. Commands tell the child to do something. And commands can be something about like, please hand me the crayon, please put the Lincoln Logs back in the box, please hand me if you're playing with toy food, please hand me a hamburger. Once again, it's really leading the play and taking the play away from the child, and it can create some conflict, and it's just not as much fun and enjoyable for a child if a parent is telling them what to do all the time when they're playing together. And also reducing different criticisms. So obviously a criticism could be something like, that's not how you do that, that's the wrong way, that was a dumb idea to color the sky pink, things like that that parents can say. Those are obvious criticisms. But anything from using the words no, don't, stop, quit, and not, those are different kind of criticisms as well. Because once again, you're taking the lead away from the child. It can give attention to negative behavior. It lowers the child's self-esteem. It can cause some anger and hurt feelings between parents and child as well. And it really kind of just, you're drawing attention to some of that negative behaviors when really you're just trying to pay attention to a lot of the positive and ignore some of the minor, smaller disruptive behaviors. So more high quality parent-child interactions, when parents are spending time with their children, particularly younger children, they want them to be praising, reflecting, imitating, describing, using a lot of enjoyment, and also trying to reduce the amount of questions, commands, and criticisms that are occurring in that context. So those are a lot of things that you try to do to really enhance the relationship between parents and children. I do want to spend a little time also talking about how to teach parents to give effective commands, because this is really important as well. Many times parents say, my child doesn't listen to me. He doesn't do anything that I tell him to do. And then when you start asking him, giving examples of commands, you start to see why maybe some of these commands are not necessarily the most effective. So an important part of behavior management is that you're teaching parents how to give effective commands. So one of the best ways to help parents give effective commands is that you want them to give direct commands. Direct commands are commands that tell the child directly what to do and who's going to be doing it. So for example, please hand me the block is a direct command versus will you hand me the block? If you're asking the command in the form of a question, you're kind of making it sound like it's an option and that the child can do it or not do it. If you want them to do it, tell them what to do. Don't ask them in the form of a question. Or sometimes parents say, let's put the blocks away. But what they actually mean is they want the child to put the blocks away, but they use the word let's. That's meaning that they're both going to do it. And that's many times kids will say, it's like, you need to help me. You said, let's do it. Kids are really literal with their language. So parents need to be really thoughtful. If they want the child to do it, they need to tell them, please put the blocks away. So direct commands versus indirect. Direct commands means it leaves no question of the child is being told to do something. It's not implying a choice, and it really reduces confusion for the child. Also, you want commands to be positively stated. So what I mean by positively stated is you're telling the child what to do, not what not to do. And this is actually kind of hard for a lot of parents. So many times parents will say, stop running around the room. What they actually want the child to do is to walk. But you're saying, please stop running. What the child may actually do, and I've seen this before, is start crawling. Well, because they're not running anymore. Or they may get in the ground and then roll on the ground because they're not running anymore. But the parent is still unhappy with that because they didn't tell them what they wanted them to do. They want them to walk. So you simply tell them, please walk. Other times they tell their hands like, stop touching stop if they're in a grocery store, they're like, stop touching the food or something like that. You're telling them what not to do. What you actually want them to do is please keep your hands to yourself, or please put your hands in your pocket. So once again, if it's positively stating, you're telling them what to do instead of what not to do. It helps avoid criticism of the child's behavior, and it provides a clear statement of what the child can or should do. So it's positively stated. It's not necessarily something good that they're doing. It's just that you're telling them what to do, not what not to do. Also, commands should be given one at a time, and this is a really important one as well. Many times parents, what they do is they it's called like chaining. They link a lot of commands together, like go upstairs, brush your teeth, change your clothes, grab your backpack, and come down here and sit on the couch. That is way too many commands for a child to be doing, especially those who have experienced different types of trauma as well. Many times there can be difficulties in remembering all the different things that you're telling them to do. So it's important to be giving them one command at a time. Like, for example, put your shoes in the closet instead of put the shoes in the closet, take a bath, and brush your teeth. So giving them one command at a time. And also the commands shouldn't be these really large inclusive commands like clean your room. That's way too big of a command. It needs to be, please put your shirts in the hamper first. And then when they do it, then now say, please put your Legos on the shelf. So giving them one command at a time instead of just saying clean your room, because that's too big of a command to be giving them. So if you give them one command at a time, it helps the child remember the whole command, and it also helps the parent determine if the child has actually complied or if there's non-compliance. Because if you tell them to do 3 things, but they do 2 out of the 3, did they comply or is that a non-comply? It's kind of hard to know exactly. So by giving them one command at a time, it makes it easier to know if there's been compliance. Also, commands should be specific. So what I mean by that is that you're telling them exactly what you want to do rather than being vague. Many times parents say, be careful or behave. It's like, what does that mean to behave? What does that mean to be careful? Oh, you might want them to get off the chair and get on the ground. You should tell them, please get off the chair. Or please put your feet on the ground. Or if they're running around and screaming and yelling, instead of saying behave, you should say, please talk in a quiet voice. Or please come sit by me on the couch. So commands that are specific rather than vague, you're going to get much more likely to be get compliance from the child. Also, you want commands to be age appropriate. And I know that kind of makes intuitive sense, but there's many times that parents give commands that are not really developmentally appropriate. It's not within their skill set. It's not within their developmental repertoire, so they're not going to be able to do it, and the parents get kind of upset. But it's because the child actually can't do that. So being careful with the type of language that you're using with the parents are using with the child, and making sure it's something that they can actually do, because it makes it possible to actually understand the command and comply. It's not fair to them if a parent is telling them to do something that they're not actually able to do. So commands should be more age and developmentally appropriate. Commands also should be done in a politeful and respectful manner. So instead of kind of screaming or yelling or involving too much emotion, what should happen is the parent should say in a very neutral tone of voice, please hand me the block, instead of saying in a loud voice, hand me the block this instant. Because really you want them to comply and listen to the parent when they're speaking in a normal tone of voice. You don't want them to ignore their parent when they're speaking in a normal tone of voice and only comply when the parent is screaming or yelling. And also, if you think about this at school, you want the child to be able to comply with the teacher when the teacher is speaking in a normal tone of voice. It also just shows respect for the child, that it just shows that we respect enough and respect each other. And you can think about some kids who maybe have experienced trauma, especially if there's been domestic violence in the home, and there's yelling and arguing and fighting, and people are giving lots of commands when they're like in a raised tone of voice. That can actually be triggering for a child and actually can be a trauma trigger because maybe they witnessed domestic violence in the home. So you really want commands to be done in a very politeful and respectful manner. And also you want commands to be done only when necessary. Sometimes parents give lots of commands and way too many that's really not developmentally appropriate for them to be having that many commands. And sometimes it's just easier for the caregiver to do it. They should just do it themselves, because whenever you give a command, you kind of have to follow through with a disciplinary strategy if they do it, or you kind of give them a praise if they do actually do what you tell them to do. So you really should only give commands when necessary, because it helps decrease the child's frustration, and it makes it really easier for parents to kind of follow through any type of disciplinary procedure as well. So more effective commands tend to be direct rather than indirect, so you're telling them exactly what you want them to do. It's positively stated, so it's clear that they're the one doing it and what to do versus what not to do. Commands should be given one at a time. They're specific rather than vague. They're developmentally appropriate. It's done in a polite and respectful tone, and commands are only given when it's necessary. So that's another important part of behavioral management of children as well. So not is it just only enhancing the relationship between child-directed interactions, parent-child interactions, but it's also helping them give more effective commands to get more compliance from the child. Now I'm going to move into kind of more reinforcement systems as well. So reinforcement is a really important aspect of behavioral methods. Basically with reinforcement, you want to increase positive, pro-social, and desired behaviors in children. So basically, reinforcement means it's a process in which a behavior is increased by the consequence that follows it. So you want to increase positive behaviors that the child is doing through various reinforcement strategies. But there's different factors that will influence the effectiveness of reinforcement. So one, you have to be thinking about the immediacy of the reinforcer. The sooner that the reinforcer comes after the behavior, the more effective it will be. So imagine that the parent wants the child to become more independent with getting ready in school in the morning. So the child gets is independently getting ready for school in the morning, but then the parent doesn't actually give a reinforcer until maybe dinner time and says, oh, you did so well this morning. Here, you can have an ice cream sandwich. Well, that sounds kind of nice and all, but the reinforcer, the ice cream sandwich, is coming about like 12 hours later after the child actually did the behavior. That's not a very effective use of the reinforcer. The reinforcer needs to come as soon as possible after the behavior occurs to make it more likely that the behavior will occur again in the future. So maybe in the morning, maybe if there's a special snack on the way to school or a special snack that the child can have because of doing well in the morning, that means that the reinforcer is happening almost immediately after the behavior happens, and that makes it more effective. Also, you need to make sure that the reinforcer comes every time that the behavior occurs. And this is especially important at the beginning when a child is learning a new skill. It's important for them to give a reinforcement every single time the behavior occurs, because it's literally letting them know, like, oh, I'm really excited and interested in this. I want to do this now. And it's because they're getting the reinforcer every time it happens. Like I said, especially at the beginning. Also, you want to make sure there's a little access to the reinforcer. If you're trying to use an ice cream sandwich as a reinforcer for a child at dinner time, but they get ice cream at lunch every day, that may not be the best idea because they're already getting ice cream, and now they may not be as motivated to have ice cream at dinner because they're already getting it at lunchtime. So whatever the reinforcer is, you want to limit it so that it becomes a more powerful reinforcer. And that kind of gets to my next point as well. The reinforcer needs to kind of be potent or powerful. If you're trying to reinforce the child, once again, with ice cream, I really like ice cream, so I think I maybe use that for myself as a reinforcer, maybe too much. If you're trying to do it with ice cream, but the child for some reason doesn't like ice cream, that's not a good reinforcer because it's not motivating, because they're not really caring about what the reinforcer is. So you need to make sure that it's something that the child actually enjoys as well. So one primary type of reinforcement is praise. And praise is something that really should be done for everyday activities, such as compliance, sharing, following rules, because the idea is that this is probably going to happen frequently throughout the day. So you're going to give them verbal praise. So once you're telling them specifically what they are doing that you like. And effective praise, like I already mentioned, is specific. So imagine a child shares with his sister, but the parent just says, thank you. To the child, it's not really clear why they're getting the praise. Are they getting praise because they shared with a sister? Do they get praise because they're sitting on the ground? Do they get praise because they're watching television? What is the thank you for? So praise needs to be more specific. So thank you for sharing with your sister. Now the child knows, oh, I get praise when I share with my sister. That's going to make it more effective and more likely the child will share again in the future. Also, similar to one of those main strategies with reinforcement, you have to think about more of the immediacy of it. So if the child shares with a sister, right away the parent needs to say, thank you so much for sharing, as opposed to later on in the day saying, oh, when you were watching TV with your sister, thank you for sharing. Well, that was like 4 or 5 hours later. That's not as effective of a reinforcer because it didn't happen right after the behavior occurs. Like I said, it needs to be consistently done. And also needs to avoid having more of a qualified statement. So instead of saying, thank you for minding, some parents may say then, well, why don't you always mind? Or thank you for minding, your sister minds every time, why can't you do that? So you kind of gave a praise, but then you qualified it with some other statement, and that kind of negates the praise then. Excuse me. And praise needs to happen at the same level or intensity of kind of as criticism or kind of correction that happens. So criticism and correction needs to happen in a very kind of neutral, plain tone of voice without a lot of emotion, whereas praise, you can have a lot more emotion, a lot more excitement, because that makes it more energizing and more exciting, and it makes it more likely that the child is going to want to do that again in the future because they're getting more attention for the positive behaviors when you're offering praise. So you want praise to happen at the kind of the same level or intensity. I say at a higher level, actually, or intensity as what criticism or corrective feedback that occurs. So praise is one great type of reinforcement. Another type of reinforcement is more tangible rewards. So this should be done for situations that are not necessarily day-to-day situations, like I said, compliance or sharing or following rules. That should be done with praise. More kind of like special situations that are occurring, such as maybe a trip to the grocery store and with compliance there, or some other situations, then you can use more of these tangible, kind of small little rewards and privileges. Because you can imagine if it's a really big deal to go to the grocery store and you're there for a whole hour and the child behaves, really it would be a good idea to have some type of reward at the end. Maybe on the checkout station, maybe they can pick out a candy bar or a soda or something like that because of their good behavior. Because you don't go to the grocery store all the day, every day. Well, maybe some of you do. I guess I go like once a week and have a bigger trip. But if it's a bigger trip and they had to be there for an hour and have good behavior, you want to have a reward for that because that was a special situation. Or I guess maybe every day they do their chores, but maybe on a Saturday they have to do their chores and their sister's chores because maybe the sister is at a friend's house overnight. Well, that's more of a special situation where a tangible reward could be offered in that situation because that's more of a special or unusual or non-day-to-day situation. And rewards also can provide additional incentive to help stimulate motivation as well. So rewards, like I said, can be some really good things to do in more of these special non-day-to-day situations. And rewards often are a good way to manage rewards are through a behavior chart. And behavior charts are really great. They can be done with kids as young as 4 years of age because they're visual. It's kind of less abstract. You can kind of see the progress as well. For younger kids, kind of like preschoolers, they can do like things like star charts or sticker charts. And it's not until about more kind of like age 8, 9, or older, depending on the development of the child, where you can do more like a point system and different behaviors. Children get different points and they can trade the points for different rewards as well. You can see in this little behavior chart here that there's 2 different behaviors that the parents want to increase: making the bed and brushing their teeth, maybe for this preschooler. And you can see during this week, the child was able to make their bed 5 mornings and they brushed their teeth on 4 different mornings. So this is a good way of trying to manage some of these behaviors through behavior management with a behavior management chart. But when you're making one, you have to be really thoughtful about defining the different behaviors. So they really need to be specific, clear, simple, and positively stated. So maybe with that behavior chart, the example was the child needs to brush their teeth for 30 seconds after breakfast. And if so, then they get the star. So that's a really clear example. It's the behavior, brushing your teeth. It's for how long, 30 seconds, and when it needs to occur after breakfast. Some parents want to create behavior charts for like listening or compliance. That's not really the best thing to have behavior charts for. Usually you can do more kind of praise for listening or minding, because that's going to happen probably all throughout the day. And if you're trying to give tangible rewards for all these behaviors that are occurring, you're going to give like 30 different rewards throughout the day. And that's not really practical. So really you need to do things like listening and compliance. Praise is better for that. So, but you want to make your chart and then you want to display it. And you want to have daily rewards and weekly rewards. So daily rewards can be like small little things, like a small toy. Maybe they can stay up 10 minutes past bedtime that night. Maybe there's a preferred snack, or maybe they get to have extra kind of special time with their parent before going to bed that night, or they get to pick out the game they're going to play. So a daily reward is something they can earn at the end of the day for positive behavior, versus weekly rewards are ones that they earn at the end of the week if there's been a specific criteria that's been established and they have met that criteria. So this can be like an outing with a parent, maybe spending a night at a friend's house, renting a movie or a video game, or maybe there's an allowance. So the idea is that basically they want to have daily rewards, and then they can earn, like, so many daily rewards can turn into a weekly reward. So, and setting an appropriate goal is critical for the success of a behavior management program, though. So it's really important. If the child does not start earning a daily reward within the first few days, the program's really not going to work. The child needs to know that it's possible for them to earn the reward. If that reward seems so unlikely to happen, or no matter what they do, they're never going to achieve it, well, you can kind of guess what's going to happen. The child's not going to really be motivated, and the child's not going to do the positive behavior anymore. So it's really important that the child achieves that goal. It builds success. It builds positivity that they can actually achieve and earn that goal. So you can usually use a simple shaping process when setting your goals as well. So you want to set your first initial goal slightly above the number of times the child is already doing the targeted behavior. So let's say the child is brushing their teeth and only brushes their teeth 2 times a week. That first week, their goal is 3 times a week. Some parents will say, I want the goal to be 6 times this week. Like, oh my gosh, we currently are doing it, the child's doing it twice a week, and now next week you want them to do 6 times a week? That is way too big of a goal. We'll eventually get there, but you need to shape the child's behavior to get there, because they're not going to get there. They're not going to earn the reward. This behavior chart's going to just stop being used right away because no one's happy. The kid's never getting the reward. The behavior is not happening. So the parent isn't happening either. So you want to start the initial goal slightly above the number of times the targeted behavior is already occurring. And make it easier for the child to earn the reward for good behavior, to experience success. And like I said, if the goal is too high, the child is going to give up before they experience success with the rewards, and they're going to stop using it. And like I said, no one's really happy. So what can happen, though, sometimes, these are some of the pitfalls that happen. Sometimes the child never earns the reward. What may happen is that, once again, the child may perceive the reward as not obtainable, or the goal is set too high. So you can, like I said, use a shaping process, set the initial goal slightly above the current behavior. So maybe first it's happening 2 days a week, so the first goal is 3 days. So once they're doing 3 days, then the next week the goal is 4 days. And once they're consistently doing 4 days, then the next week is 5 days. And you can work your way up to the goal. So that's kind of the shaping process, setting the goal a little bit higher each and every week, as long as they are already achieving that goal. And a possibility of why the rewards are not being earned, it's because the kids aren't really that excited or interested in achieving or obtaining that reward. Like I said, it's an example of maybe it's like the reward is ice cream, but the kid doesn't really care about ice cream. So that's why it's really important to kind of have a menu of rewards so they can have a variety of different things to choose from. So you got to be thinking about, they're not earning the reward. Is the goal too high? Does the child think that they can't earn it? Or is it because they don't really want to earn that reward? And sometimes the child stops performing a behavior after the parent stops offering rewards, and this happens as well. So what you want to do when you're getting done with using this kind of behavior management strategy is you move from a continuous reinforcement schedule to an intermittent reinforcement schedule. So what I mean by that is, let's say the kid gets to now their targeted goal of 5 out of 7 times per week they're brushing their teeth, and you're offering a reward every week. That's a continuous schedule. You're giving reward every single time they achieve the goal. Moving to a more intermittent schedule means that you periodically give them the reward when they achieve the goal. So now maybe 1 week they don't get the reward even though they did it. But then the next week you give them the reward. This is similar to like a slot machine. If you've ever gone to the casino and gone gambling, the reason that people keep on gambling and pulling the slot machine lever over and over again is because it's set on an intermittent reinforcement schedule. Every once in a while, you get money out of it. You can imagine if you keep on pulling, you never get money out of it, people will stop playing. So the casino owners are smart and they know use an intermittent reinforcement schedule that'll keep people playing and keep on doing that because they get rewarded every once in a while. The same thing for the child. If the reward is powerful enough and the child is motivated for the reward and it's set at an appropriate level, they're going to keep on doing it even though they don't get a reward every single week. So moving from a continuous to an intermittent reinforcement schedule, or you can gradually fade out the rewards by gradually adjusting the goal and pairing the rewards with praise. So maybe first it has to be 1 week of 5 out of 7 times of brushing your teeth. Eventually maybe the goal is then 2 weeks. And once they're doing it for 2 weeks, then maybe it can be 3 weeks. And then after 3 weeks, you get a goal. So you're adjusting the goal, but you're always pairing your reward, a tangible reward, with praise. Because really you want kids to be doing things because they are earning praise and attention from the parent or caregiver. That really is the ultimate goal. They're doing things because they like your attention. So pairing tangible rewards with praise is very important. Okay, and sometimes the behavior chart works for a few weeks and then it stops working. This has happened a lot with parents that I've worked with. What usually happens is there's an inconsistent management of the program. Once again, it's maybe the kids are not achieving the goal, or maybe they were, but then the parent stopped monitoring, or now maybe the parent is not using a menu of options, so the kid doesn't really care about the reward anymore. So that's why you got to just make sure that you keep on updating the menu, letting the child choose the reward, and also making sure that parents are monitoring and paying attention and they're putting the stars or the stickers or assigning points for it. But usually it stops working, not because the program didn't work, it's because the parent or the child were not interested in doing it anymore. So then you need to kind of troubleshoot and kind of think about some other strategies that can possibly be done. So those are reinforcement systems. Usually it's the use of praise and the use of tangible rewards that are done through behavior charts. Okay, next I'm going to talk about punishment strategies a little bit. So punishment are strategies that are used to decrease more negative or undesired behavior. So reinforcement, we want to increase positive pro-social behavior. Punishment, we want to decrease negative undesired behaviors. So the punishment is the process by which a behavior is decreased because of the consequence. Reinforcement of behavior is increased because of the consequence. Punishment behavior is decreased because of the consequence. But some of the factors are similar with reinforcement and punishment. So once again, the punisher needs to occur immediately after the behavior occurs. I've worked with many families before that maybe have a preschooler at home, and the parent says, and I ask them kind of the disciplinary strategies, and sometimes the parent is like, well, I don't like to do the discipline. I let the other parent do it. So if it's in the morning and they've been bad, I just say, wait till your dad gets home at the end of the day and then you'll be in trouble. That happens a lot, but unfortunately that's not a really effective use of punishment strategy, because once again, the kid comes home, the parent comes home after work and then the kid gets in trouble, but that punisher, maybe it's a spanking or a going to bed early or losing access to a video game, is happening at a completely different time in which the behavior occurred early in the day, maybe hitting sister, that they're not making the connection between the two. So the punishment needs to happen right after the behavior occurs to make it more effective. Also, the punisher needs to be given every time the behavior occurs, and also need to make sure the punisher is powerful enough. For example, if a parent says, well, now you just lost access to your video game for a week, but they maybe don't really care about video games, or they have like a different video game system in the home that they can play, that's not an effective punisher because they don't really care about it. So with rewards, you got to make sure they care about it, but you also have to make sure as punishers they have to care about it as well. There definitely are some considerations that need to be thought about whenever parents and caregivers use a different type of punishment system or some strategies. Punishment doesn't really it really tells the child what not to do. It doesn't tell them what actually to do. It doesn't automatically increase good behavior. For example, let's say a kid hits his sister, and because of that, he goes to timeout. Well, that timeout is a punishment strategy that could decrease the child from hitting his sister. However, the child may not automatically start sharing with his sister, which is maybe actually what the parent wants the child to do. So punishment may decrease the behavior, but you automatically won't see more positive behaviors though, which usually is what parents want to see. They want to see more sharing, but simply by punishing hitting doesn't mean you're going to get more sharing. So it really teaches kids what not to do. It doesn't teach them what actually to do. Punishment many times leads to this really negative interaction between parents and children. It really can kind of disrupt a mood. Kids get more irritable. They're kind of angry. They get upset. Well, because they don't like being punished. So with reinforcement systems, there usually tends to be a lot more positive emotions. With punishment systems, there tend to be more negative emotions and people being anxious or frustrated or angry or upset. Also, punishment can lead to escape or avoidance. So if a kid has done something bad, many times they're going to try to escape from the situation. If a kid knocks over a lamp and breaks it, the kid tries to hides in his room or goes outside, or the parent comes home and they try to get away from the parent because they know they're going to be punished. And also many times punishment really increases the likelihood of lying occurring as well. A child may blame their sibling or someone else that they broke the vase and not them because they don't want to get in trouble. So with punishment, sometimes as a result of that, lying may become actually more frequent. Punishment also can become overused because it's actually reinforcing to a parent to use that skill. For example, maybe they're in the grocery store and the kid really wants Oreos. And I'm using Oreos because that's definitely one of my favorite cookies. So imagine they want Oreos and the kid is having a tantrum because they want Oreos and the parent's like, no. So the parent starts maybe yelling or screaming at the child. And maybe the child actually stops grabbing the Oreos. What has happened, the punishment, the yelling, has actually stopped the child's behavior. But what that does then is that rewards the parent's yelling, and the parent may be like, oh, every time I yell, they stop being bad. So the issue with punishment, it may stop the child's negative behavior, but it rewards the parent's punishing behavior, so it makes the parents more likely to use that punishment strategy in the future. So punishment sometimes will become overused because it's getting reinforced. And frequently parents, when they're using disciplinary strategies, primarily only use punishment strategies and do not use reinforcement strategies. So punishment often does work best when it's used just a little bit, it's used sparingly, and there's a lot more positives that are happening. There's more likely to have tangible rewards and praise. Short, mild punishment is best, but it really needs to fit with the age of the child. So I'm going to talk about a few of these different kind of punishment strategies as well. Okay, so the first punishment strategy I'm going to talk about is timeout. So many parents will say, oh my gosh, I've tried timeout with my child. It was a nightmare. It didn't work. So once again, we talk about and troubleshoot why timeout did not work, and many times it's the lack of consistency. If you remember from the very first slide, I said consistency is the most difficult part of behavior management strategies, but it is by far the most important. So many times timeout does not work because parents are not consistently using it. But timeout is a process in which a child is being removed temporarily from all positive reinforcers for a brief period of time following the behavior problem. So they did something bad, they're being removed for a short period of time from anything that's reinforcing. So some considerations that you need to think about, why did the child actually do this behavior? What's the function of the behavior? So if the child does a behavior like hits his sister and then has to go to timeout because the sister took something of his, that can maybe be appropriate use of having a timeout because the timeout is actually worse than kind of playing with the sister. However, if a child is in a situation maybe at dinner time and doesn't want to be at the dinner table and hates being at the dinner table and acts up and has a tantrum and then is being sent to timeout, actually for the child, timeout may be seen as a better option than sitting at the dinner table. So by giving a timeout, you're actually reinforcing the child's behavior of acting up at the dinner table because they'd rather be at timeout than at the dinner table. The same thing with going to bed at night. If they're getting out of bed and they're going to timeout every time they get out of bed at night, the child maybe doesn't want to be in bed. So by giving them a timeout, you're actually making it more likely that they're going to get out in bed in the future. So timeouts can reinforce kind of more escape or avoidance behavior. So you really have to think about what is the function of this behavior. Also, you have to think about different practicality considerations. So timeout often has a chair. You want to have an adult sturdy-sized chair that the child can sit on. Sometimes for younger kids, parents get these little chairs that are small and they're decorated and really cute. No, you just need to have an adult sturdy chair. You don't have to, because like the idea is like this is not fun to go to timeout. So you have to think about where's your chair, where's the location of the chair going to be, because you got to make sure it can't be in the same room as the living room because they're going to just sit there and watch TV then. So you got to figure out where is the chair going to be, because the idea of timeout, they're being removed from anything that is rewarding or reinforcing. So practicality issues, chair, size of chair, where it's going to be. You have to think about the length of the timeout as well. Some parent management strategies like Webster Stratton, Incredible Years, that parent management strategy says about 1 to 2 minutes for every year of age. So if the child is 4 years old, they should be in timeout for 8 minutes. Other strategies say about 1 minute. I tend to use 1 minute, or even different programs like parent-child interaction therapy. It's for kids 2 to 7. They just always use a standard of 3 minutes. So like I said, it can vary a little bit, but usually for younger kids, I just do 3 minutes or maybe a minute for every year of age, depending on how old they are. Because you want to make sure it's just long enough for them to get the idea that this is not fun or enjoyable. Trying to send someone in timeout for a half hour, that's not really practical or feasible. And you also make sure that absence of the problem behavior is required before termination as well. So if the kid goes to timeout because they're screaming for some reason, you have to make sure they don't get out of timeout when they're actually screaming, because that problem behavior is still occurring. You also have to make sure that the kid is not able to escape from the timeout chair either. If they can just get up and run around the room, well, then timeout really isn't a consequence for whatever their problem behavior was. And really, you need to try to avoid your interactions with them. You need to monitor them out of the corner of the eye, get out of the chair, put them back in the chair without saying anything else to them and without showing a lot of verbal and nonverbal emotion, because you're giving them attention then. Because once again, timeout means you're removed from all sorts of reinforcing behavior, including attention. So those are some considerations that need to happen. And I know I don't have enough time to go through everything about timeout, but I probably could have a whole hour-long talk about just timeout. So I just want to have this as a really brief overview of what timeout could look like as part of a punishment strategy. Another punishment strategy is called response cost. That's a very behavioral term for it. Other people think about kind of like loss of privileges. So someone loses a specific amount of a reinforcer whenever the problem behavior occurs. So I'll give some examples a little bit, but some considerations you have to think about: what is the actual reinforcer? Because if you're removing something for a period of time, it has to actually be meaningful to the child. Once again, it's kind of the example of a parent is going to remove video games because maybe they got an F on the report card and now they can't play video games for a week. But if a kid doesn't really care about video games, that's not really meaningful. You have to think about the amount or the time lost when this response cost occurs, such as maybe if they have to, whenever they swear, they have to put a quarter or a dollar in the jar, or do they lose their video game for a week or a whole week? So what's the amount or time that's being lost in this response cost? Is this an immediate or a delayed loss? Is this the response cost happening right now? Or is this something later on? For example, for an older kid, maybe because they broke curfew, now they can't go to a friend's house for the weekend or go to a party for the weekend or use the car, even though they broke curfew on Tuesday. So with older kids, they can kind of have more of a delayed punisher. So now they just lost access to what they want to do on the weekend. So that's more of a delayed loss. And I also have to think about ethicality as well. You can't deprive children and adolescents of basic necessities. You can't deprive them of food. And especially we're talking about kids who have experienced trauma as well. You have to be really thoughtful about what are some things that maybe they've experienced in their life that if you're trying to remove that as well, that is something that can be triggering and can be more of a trauma reminder. So some examples of response costs could be, once again, you could put a quarter in the jar whenever they swear. They lose 30 minutes television time if they lie, or they don't get dessert because they were aggressive during the day. Or even for teenagers, like I said, they lose access. Like maybe they scratched up the car and now they can't use the family car for the next month. So that's response costs. Positive practice is another behavioral method that's a punisher. Really here, the child has to do the correct form of the behavior following the problem behavior. So this kind of gets to, if the child slams the door, they have to practice 10 times shutting the door appropriately. So this is a punisher. It's kind of letting them know that whenever you do the problem behavior, you have to do the correct form of it over and over and over and over again. So once again, it's kind of teaching them, this is the consequence. You slam a door, I'm going to make you do it correctly a number of times in a row. So that's called positive practice. And then finally, restitution. I'm going to do this a little bit quicker because I want to make sure we can save some time for some questions at the end. Restitution is when a child or an adolescent corrects the environmental effects of the problem behavior and actually restores the environment to a better condition before the problem behavior ever occurred. For example, if there's a child that's using markers and then writes all over the wall, they have to clean not just their own bedroom wall, they maybe have to clean the kitchen wall as well. So you're returning the environment to how it was before the problem behavior, but actually returning it to a better than it actually was. So they have to kind of clean the walls of several other parts of the house as well. So that's called restitution. So returning the environmental effects back to the level of the problem behavior and actually making it a little bit better. And the final skill we're going to talk about is called selective attention. And this is what I alluded to a little bit earlier. This is a really, really important aspect of behavior management. For attention-seeking behaviors, such as a kid whining or, interrupting when you're talking on the phone, sassing, or talking loudly, if they're doing that for attention, the best thing to do is actually ignore it. Some parents say, well, I'm just letting the child get away with it then. But actually you're not, because what the child wants is attention. So you're withholding attention from them because they're doing a negative behavior. So really the best idea is to ignore this. It's really hard to do, but it really is important because it removes and prevents you from accidentally rewarding any of the negative behavior. But what you need to do then is, so when the problem behavior is occurring, you're ignoring it. Like I said, these are minor, smaller, disruptive attention-seeking ones. These aren't like hitting people or hurting or harming themselves or other people. That's something different. This is just doing things for attention that are not harmful or threatening. You have to ignore it. And then when they do the opposite of it, the positive opposite, then you give lots of attention. So if they're trying to interrupt you on the phone, but then they stop and they're waiting, you immediately say, thank you so much for waiting. Or if they're whining and sassing, you ignore it, and immediately when they start talking in a nice tone of voice, you say, thank you so much for speaking to me in a nice tone of voice. Or if they're yelling and screaming and you ignore it, and then they're quieter, you say, thank you so much for talking using your indoor voice. So selective attention can work well if they're doing attention-seeking behaviors that are not destructive or hurtful. Ignoring it, you have to consistently ignore it, and then once they immediately do something positive, the positive opposite, you have to give the attention for it right away. And children will learn they do not get attention for negative behavior, because I'd rather get attention for negative behavior than no attention at all. They learn they don't get attention for that, they only get attention for positive things that they are doing. Like I said, timing is really, really important, and this can be hard to do, but this can be a really important skill, especially if parents have some younger children as well. Okay, so I'm going to wrap up there. That's kind of the end of my presentation here. I know it's kind of a quick whirlwind overview of behavior management for kids, and there is, like I said, this is an aspect I think of that can be incorporated a lot of these behavior management techniques into kind of the parenting component of TFCBT, because like I said, many of these kids have experienced trauma, have some behavioral difficulties that could benefit from giving more effective directions, using a reinforcement system, things such as timeout, doing selective attention, and also having more quality time and building that relationship together. So I will open it up to questions, so you guys can type in any type of questions in there, and then I can look at them and try to answer them I can for the next few minutes. So it looks like these PowerPoint things are recorded, so you are able to look at them later. I will have to double check about whether PowerPoint slides can be sent out to people. I'm not sure if that's something that can be done, so I'll check into that or not, and I will check that out a little bit to see if they can be sent to people that are interested, because I think there's a few questions about getting copies kind of the slideshow or the PowerPoint of the webinar. But are there any other questions about kind of behavior management with kids who've experienced trauma, or even other kids that have not experienced trauma? I'll just kind of look up there for a second if there's any other questions that pop up. Okay, let's see here. Yeah, okay, so this is a really good question about, in my experience, are there behavior management techniques effective with kids who have experienced trauma, or how does trauma keep these from working? That's a really great question. So like I said, in part, we have several different evidence-based practices for children who have specifically experienced trauma in which these behavioral methods are incorporated into those interventions. So at TFCBT, like I said, parenting is a critical component of TFCBT. All of these different behavior management system techniques can be incorporated into those parenting practices. Yes, you can still definitely use timeout for kids who've experienced trauma. Yes, they can learn to sit on the chair. They can, all of these things can be done. Another part of a program that we use for kids who've experienced trauma who have significant behavioral difficulties is parent-child interaction therapy. Parent-child interaction therapy is all about building that relationship, but then giving effective commands and using a timeout system. Kids with behavior problems stemming from trauma can learn how to follow directions and use the timeout chair. See, this is the thing that you have to be really thoughtful about, why you're trying to make sure that there's not too much emotion part of it. Because I said many of these kids maybe have witnessed domestic violence or they've witnessed a lot of aggression. So that's why parents need to be really calm, kind of cool and collected when they're doing these behavior management systems. Because yes, parents arguing and yelling and threatening can be a trigger for the kids. So that's why they need to make sure they're really calm when they're doing it. But all of these different techniques are definitely things that can be done within the context of trauma. Okay, I think Chad has one quick thing that he needs to add a second.
I just wanted to thank Glenn for doing this webinar. I know we're kind of close to the top of the hour, and we'll take probably one or two more questions after I'll announce my announcement here, but the CEU code is posted there, so be sure to email me, and it's helpful if you tell me your first and last name. If you happen to be watching with a group of other individuals, if just one person can let me know who you watched with, it's just easier to kind of verify who actually attended. So, so I'm going to turn it back over to Glenn. We got a couple of other questions that came in here. So again, thanks for kind of coming out, and hope to see you next month too. So.
All right, thank you, Chad. Yeah, so just to follow up on that, so like I said, behavior management strategies are a critical part of TFCBT. We do parent-child interaction therapy for kids who have severe behavior problems, and also our other primary intervention for young kids who have trauma, child-parent psychotherapy. Behavior management is a part of that as well. Like I said, it's important for you to kind of know the kids' trauma symptoms and maybe some of their traumatic events, so you can be really thoughtful about that. That many, like all kids that have experienced trauma, it's okay for them to have a timeout. You're not going to be, and also building relationships and using reinforcement systems. All those things are especially helpful for kids who've experienced trauma, because many of them maybe don't have the best relationship with their parent or caregiver. Now they're in the foster care system or in a pre-adoptive home. You want them to develop a closer relationship with their caregiver. Another question was about for early teens. Yeah, so some of these things maybe look a little differently depending on the age range. Some of those the slide that I was talking about how to have more parent-child interactions. A lot of those things are maybe for a little bit younger kids who have some behavioral difficulties. But even for teenagers, it's great to spend a one-on-one time with a preteen or a teenager. The activity may look a little differently. Yes, maybe you're not going to do some reflections and descriptions with a preteen, but you're still going to give them praise. You're going to still spend time with them. You can definitely use any type of maybe you're not going to be using a timeout with an older kid, an older school-age kid or teenager, but you can definitely use response costs. You can remove privileges. There's grounding. You can use different reinforcement systems. You're less likely to have like a sticker or a star chart with a preteen or an adolescent, but you can use a point system. That will definitely work with adolescents as well. And sometimes with adolescents, you can have more kind of behavioral contracts, and it's more of an agreement that if you do your chores this many times a week, then this will be kind of the outcome or kind of your reward. So adolescents sometimes have more behavioral contracts, but those are things that can happen as well. Another question, parents tell me that frequently that their child will not obey timeout. How does the parent manage this without getting into a conflict with the child? Yes, timeout, yikes. Like I said, that can be really hard. So I'll tell you how it's done in the context of, we'll say, PCIT. So parent-child interaction therapy. They give a command, and if the kid doesn't do it, they get a warning. If they still don't do the command, then they have to go to sit on the timeout chair. With PCIT, so these are for kids between 2 and 7, if they get out of the timeout chair, actually there's something what we use like a backup room. This is a different room in their house that's at least 4 feet by 4 feet that they have to go to this room for 1 minute. And once they are calm in this room, then they have to go back to timeout and sit in the timeout chair and still serve their timeout, which is 3 minutes long. With this timeout, like this backup room, basically you want to make sure that, think about safety. There's nothing in there that's going to be harmful to themselves or to anything else in the room. Sometimes there's a spare room. Sometimes the kids' room doesn't have as many toys in it. It can be a spare bathroom if you kind of make sure that there's no chemicals in it, there's no bath toys or anything. And most of these kids kind of just stand by the door because they want to be out of the backup room. But the idea is that they get out of the timeout chair, they have to go to the backup room for a short period of time and then go sit back in the timeout chair. Because if they can get out of the timeout chair whenever they want, then that's not really a consequence. But here, kids learn really quickly that if they get a timeout, they just have to go to the backup room, and they don't like that either. So it makes sense to just kind of serve the timeout. And really, the parents have to really control their emotion. They almost have to be robotic. They have to say the exact same thing every time in the same order. Like, oh, you have to go to timeout because you hit your sister. Stay on the chair until I say you can get off. And they can't say anything else. The kid gets out of the chair, put him back in the chair, stay in the chair until I say you can get off. This may be a struggle, but if they consistently put him back on the chair, he will stay on the chair. The thing is, there's consistency issues. It's really hard, especially at the beginning, because the kid is still trying to learn what to do with timeout, and they don't like it, so they're kind of pushing the limits, and they want to get out of the timeout chair. The parents have to consistently put them back in the chair, and they have to have a calm tone of voice, controlling their emotions, and like I said, saying the same things in the same order and doing it over and over again. Kids will learn how to do it. Yes, it'll be very hard at first. I tell the parents all the time, whenever you do a behavior management principle or one of these techniques, sometimes behaviors get worse if you're using punishment, especially because the child doesn't like the punishment and they're trying to up the ante, so the parent will give in and stop doing the punishment. So you have to realize that if there's a punishment strategy being used, the child's behavior may initially get worse, but if they consistently do it, the child's behavior will improve over time. Okay, so that was a really good question. If there's any other questions or anything like this, you can definitely always email Chad because you have Chad's email on the last thing. But I appreciated talking with you guys today. Hopefully this will be some helpful information. Like I said, I will check in about if some PowerPoint slides can be sent out or not. So I hope you guys have a really good day, and hopefully this was helpful for your guys' practice. Take care, everyone. Bye.